We're taking a moment to let people into the webinar, so give us about 30 to 60 seconds, and we'll be starting.
Wonderful. Well, thank you so much for joining us this morning for our program, Georgia Voices in Public Health Leadership. I'm Rachel Hall-Clifford. I'm a medical anthropologist working in global health based at Emory University, and I'm the program's chair for our Women in Global Health Georgia chapter. Women in Global Health is a global movement dedicated to the advancement of women's leadership in global public health. So we're very excited to be hosting this conversation today. And I will hand over now to our moderator, Maria Thacker-Goethe, who is our Women in Global Health Georgia Secretariat, as well as CEO of Georgia Bio. Thanks, Maria.
Great. Thank you, Rachel. And it's good to have everyone on board and on this webinar as we welcome other people joining. This program is recorded so people can watch it other times and be available for sharing as well on social media. I think it's going to be a great conversation today. Just one housekeeping item. We do ask that you put any questions you have for our panelists in the Q&A below, and you're certainly welcome to chat with us. Rachel and Lauren will be helping me moderate that. And finally, I did drop the sign up for Women in Global Health Georgia chapter link into the chat. So if you are not already getting our emails and want to, please do so. And I encourage you to share that with your colleagues as we're looking to grow our community. So let's get started. We have a really awesome, three amazing leaders within our broader Georgia community and public health that are really helping to lead some of the biggest schools of public health here in the U.S. So thank you to all of our deans for joining us. You each have impressive backgrounds. And I really want to invite each of you to tell us a bit more about yourself, your career path, and speak to what you think career advancements in global health, public health look like in 2024 and beyond. So let's start with Dr. Davis. Dean Davis.
Hi, I'm Marsha Davis. I am Dean of the College of Public Health at University of Georgia. My leadership path has not been a straight one. It's more serendipity, I guess. I never knew I wanted a PhD and just sort of landed in that space. So I think I'd like to speak to that in a way of, I think we never know these moments when we're going to make an impact in someone's life. So I grew up in rural North Carolina. It was really in elementary school that teachers started speaking to me about you should go to college when no one in my family had. And no one really around me was going to college. And then that continued through my high school years. And through philanthropy, I was able to go to undergrad. And then through an NIH training grant, I was able to get my doctorate. And as far as leadership, I mean, it was really having a few key men in my life, a department head, a president of the University of Minnesota, who saw my potential as a leader and basically gave me a seat at the table. And without all of those, I wouldn't be here today. So you never know when you're going to make a moment with a student to inspire them to achieve things that they thought they never would.
Maria, you're muted. I don't know if you're hoping to be
About
heard.
that. Yeah, Dr. Fallin. Yeah, Dean Fallin. There you go.
Thanks so much, Marsha. I love that story. So I similarly will start with personal background. I'm from the Panhandle of Florida. I have now been in Atlanta for just about 2 years. And so this is in some ways a coming home because I spent most of my adulthood. I went to college in Florida, also a first generation student. So neither of my parents understood what that college experience was like, and certainly did not understand what a graduate school experience was like, but were incredibly supportive. Went to Cleveland for graduate school, and then was in Baltimore for over 20 years before what I think of as returning home back to the South, to Atlanta for the role at Emory. And a little bit about a similar theme in terms of just serendipity and being prepared and leaning on the kindness of others as you go through a leadership journey. I started doing neuropsychiatric genetics, really interested in Alzheimer's genetics and then schizophrenia and bipolar genetics. Most of my career, though, ended up in autism because I then got the opportunity to work with some folks who were really passionate about autism. And that led me to say, oh, although my training is in genetics, what I'm really hearing and experiencing from the science and from the people engaged in this field is that actionable environmental components are at play, and that is a public health piece that's really important. And so now my own work is really about how environments and genes play together in the context of autism, but that's a theme for a lot of public health. So that has been great. And then the other part of my leadership journey was I got to chair a department of mental health in a school of public health before I came here. So that really allowed me to advocate, first learn about, and then advocate and amplify work in public mental health broadly. And I would argue that there's really nothing that any of us do that doesn't have a mental health component to making our goals better, no matter what area of public health we're interested in. So it's just a little bit about me and how we got to this place, and I'm so happy to be here.
Great, thank you. All right, Dr. Lynn?
Yeah, thanks. It's so good to be with you, Maria, and my colleagues as well. Yeah, I'm originally from Jamaica. That's where I was born, and my family moved to Atlanta when I was about 7 years old. So this has been home for a long time, and like our other two deans, I'm first in my family to get a college degree, or a graduate or degree as well. So I think from just those, sort of beginnings, I've always had an interest in thinking about individuals and people that don't have all the access to education and maybe all the resources that some do. And so, that's been a focus of my work for since the beginning. I started working with a colleague of Marsha's, working in public housing developments, doing health education many years ago. And through that experience, really got to see and appreciate the importance that upstream factors, really, policies and others have on communities and on populations. So that's how I really got interested in public policy, higher education. And then, like you've heard from, Marsha and Danny, as well, the mentors and the people that you come in contact with, because, I wasn't coming from a family that had a lot of expertise or experience in study this, do this next. And so it's just really the kindness and interest from faculty, from people that I came into contact with over time that helped me arrive where I am today. And so I think all of us try to make sure we're giving back in that way and helping our students and our faculty and our staff to be as good as they can be and access and understand the resources that are available to help people arrive at their full potential. So yeah, I'll stop there.
No, that's great. Thanks to all of you. And I dropped in the chat the link to everyone's bio if anyone wants to dive into their specific expertise. But and yes, Dr. Lynn, it's amazing, I think, especially as you move throughout your career, how much people learn that, or don't learn, but they should learn that policy really influences each and every one of us. And I stress that. I know it's an election year, but it is critical whether you're doing research or just living your life and everything in between. It has some sort of impact on where we live, how we work, what we pay for, everything. So whenever I hear somebody say something like, oh, I don't care about politics, I'm like, you do. I promise you do. You may just not care for the drama of it. But trying to avoid the politics of that time that I think everyone in public health will be recovering from for quite some time, the pandemic, it accelerated so many international partnerships, such like building early warning systems for disease outbreak, conducting research on disease prevention and management, and in working to ensure more equitable distribution of healthcare resources around the world. I was hoping each of you could speak to a partnership your institution may be involved in, or a good example of collaboration working to advance public health that you are familiar with or your institution is doing. And I'm going to start with Dean Fallin, if that's okay.
Sure. So I think here in Atlanta and certainly at Emory, we're just so privileged to have so many global collaborations already in place, in fact, before the pandemic, right? And so that was extremely helpful. So full disclosure, everyone, I came in 2022, so I was not dean when this, when the pandemic first started, and Jim Curran was, and certainly he is a global health figure, right? But two examples might be, one is we have a lot of water, sanitation, and hygiene work within the school and in collaboration with folks, at Task Force, at Carter Center, at many other places here in Atlanta that have reach across the world. And so Christine Moe, who leads that group, was able to collaborate with folks who wanted information about wastewater surveillance across the globe. And so in ways in which that was useful for our collaborators that already existed, as well as others who were seeking that kind of information. Another example is we have a global diabetes group that does a lot of work in many parts of the world, including India, and the Indian collaborators in particular really wanted to focus on how the pandemic was affecting psychological health and economic development in India, particularly for people who are experiencing chronic disease like diabetes or other metabolic disorders. And so we were able to partner with them to do some of that surveillance work, and then to help tailor interventions specific to that psychological distress, for example, in the context of helping them to uplift those challenges right as the pandemic hit and still to this day.
No, that's great. And yes, definitely Emory went into the pandemic with significant amount of global partnerships, but UGA is a growing institution in the School of Public Health, and we were talking before the call, so this conversation started, about the medical school that the state's investing in up in Athens. So Dr. Davis, how about you? What are some collaborations you all are doing there, and some examples in collaboration and partnerships that UGA is involved in? Let me unmute you.
I believe Rodney and I had the pleasure of starting our deanship right before COVID. So I had been at the University of Georgia. I've been here for 17 years, and I was 6 months into being a dean, and then we had the shutdown, and all of the, as you said, Maria, the politics that a public university went through. So it was quite a challenge during that time. But again, we survived, and in some ways thrived through that. One of the first papers that came out of the pandemic showing that it was airborne came from relationships that we had in China. And a researcher was able to study Buddhist monks on a bus and look at transmission. But I think I want to talk about really those things that are important that we have done, maybe not specifically to infectious disease, although we're doing modeling for infectious disease with measles and mumps. But it's really, when you think about the work that we do with tuberculosis in Uganda, and I know Puerto Rico is still within the United States and not global, although that took a while for travel authorities to go through that, saying no, Puerto Rico is not international travel. But the work that Dr. Cordero does in using community health workers to help educate and recruit for research studies, it's those partnerships that we have with folks on the ground and with the private partnerships that we have with Fogarty and funding, and then with the NIH and funding, that we're able to contribute the work. And as Bill Foege would say, you know, what is global is local and local is global. So as we're working with agricultural workers in Moultrie, Georgia, the issues that they are faced, as Rodney mentioned, with access to health care, with health literacy, all of those important lessons that we can transfer no matter where we're located.
You know, I know people may not know this fact, but if I recall, I was meeting with your predecessor and he informed me that Georgia State has more African-American students than any other university in the country. So you're not, or one of the highest rates, you're not an HBCU by certification, but you have an extremely diverse student subset. And I'm sure that strengthens even a lot of your ability for partnerships and participation and building that diverse workforce for public health. But tell us a bit about some of the partnerships you're having.
Yeah, happy to. One of those partnerships where we're presently working on is with the State Department, and they seek to partner with minority serving institutions, of which we are one. So we're currently working with them to establish a partnership that would, make us their global health partner, and that would include, exposing our students to opportunities within the State Department, bringing State Department personnel here for extended visits as well. So that's one we're continuing to try to get across the finish line. I'll also build on what Dean Fallin talked about around wastewater, because we're doing some work there. I think many of us know in Latin America, the outbreak of dengue fever over the past 3 months has really been immense. That's included Brazil. We have sent students to Brazil since 2014 annually for a study abroad there, but we're also doing research there. And when you consider, Zika, West Nile, dengue, all emerging in areas now outside of, where they were, previously endemic, there's a role here for wastewater as it relates to surveillance. So, in Miami, there's been evidence of dengue recently in the wastewater. So we have a partnership led by Christine Stauber, who's on our faculty here, working with Oswaldo Cruz Foundation, also known as FIA Cruz, and other colleagues at Federal University of Bahia there and UNC Chapel Hill as well, to really evaluate methods for recovery of dengue virus testing from wastewater in Salvador, Brazil. So what we learned from that really, I think, has potential to have a positive impact here at home as well as overseas. So it's just one example or a couple of examples of things that we're doing here.
Yeah, that's really exciting, and as we all know, and as this administration and previous ones have us do as well, public health is an infectious disease is a security threat, and that is why partnerships with groups like the state agencies like the State Department are important, to also stress that public health is not just about avoiding the infectious disease we hear about and get from our children when they come home from school and things like that. This is all about security, and hopefully I continue to hope that the experience of COVID we've all been through has instilled that in more minds. So I still think we have a lot of work to do around communications and public health and elevating the importance of preventative medicine and management. But I also want to take a pivot. We have a lot of students that are involved because, of course, we have 3 deans from schools here. I want to put your HR hat on a bit, and where you're here when you're talking to employers you may work with and agencies you work with. What are some of those opportunities and challenges ahead for students preparing for careers in public health, global health, and what factors are shaping this unique moment in public health? And I'm going to start with Dean Lynn this time. I'm going to bounce around a bit. So tell us about those career paths.
Yeah, well, I think, if you talk about opportunities, if you care about, population health and equity, there really remains a lot of work to do. I think whether in global health or domestic health, there's plentiful opportunity to engage and make a difference. And I think, when we look at health, the widespread health disparities, I think what I would characterize as a crisis in migration and health, human trafficking persists at unacceptable levels. And then humanitarian crises driven by war, climate change, what we've seen with infectious disease in recent years and presently. All those are, I think, significant factors and contributors to the moment we're living through. I think politics, which has come up before, as well as misinformation and sort of lingering distrust of government. All of those, I think, and that distrust may not be across the board, but I think it's certainly there's certainly a negative perception in some quarters and about the important work that we do in public health. And I know some of us deans were on Capitol Hill last month and spoke with both elected officials as well as their staff about the importance of public health and the funding we get from federal and for federal agencies. So we certainly need greater funding at all levels. I think for students preparing for careers, you'll likely recognize that you can be a positive force for good in our country and around the world. And I'll go back to an earlier point. We have to bring others along. We have great passion for the work we do, but if we don't bring others along with us, we're not going to achieve the goals that we have. And so this means we've really got to ensure that we have the scientific and practice skills on the one hand, but that we're also really advocating for change, that the changes that we want to see. And so there's lots of work to do, lots of opportunity, but I really want to push us on the importance of advocacy and bringing others along and meeting people where they are. So I'll stop there.
No, definitely. Dean Davis, I'm going to ask you to add your thoughts. And while you come off mute, I'll just say one of the things I observe quite a bit is in public health is talking in an echo chamber. So I appreciate you saying that quite a bit. We can't keep talking to ourselves about this. We need to talk to those outside of it. So, Dean Davis?
And I think that's key to this. I mean, if you think about how the world has changed, and even through COVID, it exacerbated what we already knew in public health about health literacy and trust and health disparities. And let us not forget, during that same time, we had a racial reckoning with the murder of George Floyd. So all of that kind of coalesced at the same time, which I never want to lose that. As painful as it was, we need the skills, the scientific knowledge, that's going to happen. You can Google practically anything. Now you can get chat to write your research paper. But what are you really doing to work in teams, to understand cultural competency, to bring in all groups, regardless of whether they have the same political beliefs or the same religious beliefs? How can you work across all of those groups so that you can turn your passion into meaningful action? And that's where I hope that we are training the future public health workforce to do.
Well, that's great. Anything to add, Dean Fallin?
I think everybody has covered it so well. I mean, I would just double down on the building skills and cultural competency and cultural humility. And I think many of you who've trained in global health, that should feel familiar and sort of understanding that. But it's really true in global health that includes the state of Georgia and the city of Atlanta and the US. We're all part of the globe. And sometimes we haven't done as good a job of training our students and helping them to build those skills to be able to do that well across the different contexts. And I think the advocacy points that were already made, I would add just communications skills more generally. I think all of us, but certainly in our school, are really spending a lot of time building our communications competency and capacity amongst our own faculty and staff, but also within our curriculum, so that students can leave feeling confident in their ability to communicate the importance of these things. And then the last one I think was already addressed also by Rodney and Marsha, but that's beyond cultural humility and competence. You know, we really are facing across the globe racism and discrimination and structural policies that are informed by discrimination rather than equity that inhibit health. And so making sure that our students understand that, have the lexicon for that, have the theoretical history for that, to be able to use their public health skills for good in the ways that we've all talked about, I think is another critical thing to make sure is on your radar.
Well, that's great. That's all really important. I won't lie, when I got my public health degree 20 years ago, it would have been nice to hear these conversations then. We didn't have these opportunities to connect this way. So pivoting a bit into economic and health-related costs and things like that, the CDC and the Health Resources and Service Administration fund programs critical to improving the public's health, and public health system and workforce is the first line of defense against health threats that communities face every day, domestically and internationally. But our nation's public health infrastructure has been long underfunded. How can we work to reduce, in y'all's opinion, the economic and health-related costs of chronic and communicable diseases and injuries when we're not getting the kind of investments, despite COVID accelerating something from public health, but we're not investing in programs that really treat these problems in the same way? Dean Fallin, start with you.
Sure. Well, I mean, that's the, billion-dollar question for all of us, right? It's such a critical one. So advocacy is one. It was mentioned going to the Hill, both local and federal and other kinds of advocacy are just really critical in this. But while we're living in the system we're living in, what else can we do, which I think is your question. And I think community partnerships are something we do well in public health. And so realizing that government programs alone are not the way to make sure we're doing things upstream for prevention of disease and promotion of health. And so building mutually beneficial partnerships with community-based organizations, with other universities, with other kinds of entities that do this well, and continuing to build the evidence so that we can bring that back to our advocacy with government funding. So if those partnerships work, if we really are able to infuse, there's a HEROES program that ARPA-H is now pushing. There's many other federal programs that are saying, how do you send funds to community-based organizations to do this work? And then how do you show the evidence that that was a best use of funds? And I think the biggest challenge with some of that is the people who save money, I shouldn't say people, the entities who save money when you do a good job of prevention are not the entities that spent the money on the prevention. And so figuring out how you make that argument and you can make that economic investment pay back the right folks who made the investment is a quintessential challenge and something that our health policy folks think about a lot. So I don't know if I was a little too rambling in that, but I guess my summary would be keep working on advocacy, keep building evidence that would inform advocacy, but at the same time, build these mutually beneficial relationships with your partners on the ground. That's where the movement can happen today.
Dean, Lynn, or Davis, do you have anything to add or comment on that?
I think definitely building on community partnerships and having people who are not traditionally in public health speak about public health. So if you have a community banker who can talk about public health as economic development, or who can explain that to a legislator, sometimes our voices in public health are not heard because, well, of course you're going to say this about your own field. But when you talk to people in the community, and when they know the rate of dementia in their community, or they know when you show the graphs that the United States is not first in health, except in health expenditures. It's really training legislators, training community to, again, as Rodney talked about, bring everyone along in public health. Because traditionally, public health, if it's working, no one talks about it because you're free of disease, you're not getting illness and respiratory. So how can we talk about public health in a way that is visible and meaningful?
Yeah, I would just add, I love the comments from Danny and Marsha. I agree with them wholeheartedly. I think the policy and advocacy piece is central, but I would add to it law. We teach a public health law course here. We have a JD MPH degree program, dual degree with the law school. And I think if we look back on the 20th century, and the major leaps forward in preventing heart disease and stroke deaths and tobacco control and motor vehicle safety and all the things that we made progress in the 20th century, law was central in most of those. I think the story of the 21st century is obviously only approaching its first quarter, and there's a lot to be written. And so what's the vision? What do we want to accomplish? It would be great 75 years from now to say that was a century that equity really leapt forward, so I think there's a lot of work to do, but law is going to have to be part of it, together with the advocacy and policy that can oftentimes funds the community engagement as well. So yeah.
I love that, Rodney, as someone who remembers cigarette machines in restaurants. They're not
Yes.
there anymore.
We're smoking on planes.
Yes, exactly.
Imagine, wow.
We would like to replace them with testing strip machines and other harm reduction machines now.
Yes.
Yeah, definitely. I'm old enough even to remember cigarette machines too, and bowling alleys and things like that. So I thought they were so cool, not the cigarette part, but the machine itself to play with. So that'd be great to, capitalize on that similar idea and use innovation to bring public health into non-traditional places where people can really connect with this particular sector. And I'll just add on before we pivot a bit to maternal and child health. We live in a city that is one of the largest cities, a large city in the Southeast, one of the largest cities in the country, extraordinarily diverse, and but also has a lot of challenge. I know, Rodney, a little while ago, you mentioned human trafficking. The FBI ranks Georgia at Atlanta as the 14th highest rate of human trafficking of children and prostitution. And there are a lot of local organizations that are involved in that to help combat that. And, I as someone who has a public health degree, and I talk to a lot of young people who are looking for career pathways in this sector, and I work in the private sector though, utilize my degree. There's so many ways to plug in and apply your public health experience, even while you're a student, to volunteer and learn about other aspects in your local community, like groups like Covenant House that work in human trafficking, and local organizations that are not always traditional public health infectious disease maybe areas, like an HIV/AIDS group or something like that. So there's lots of ways to plug in your community. I try to tell people to understand what's happening in your own backyard and how you can utilize your public health degree and the knowledge about having that humility about the cultures you're working with to really, in this case, build your resume, because that's a lot of what I talk about with students, is help grow your experience while you're still learning and building, finishing your degree. We have a lot in our city that some places don't have, and UGA in Athens is not that far away. So I know y'all are deeply impacted by, in particular, human trafficking as well up there.
Yeah,
But pivoting,
Maria, I would just mention that, here at Georgia State, we have a national center on child trafficking here in the School of Public Health funded by SAMHSA. So this is an area that we're invested in doing work and, trying to, definitely connect to the work that we do day in and day out in public health.
yeah. And connecting with those local organizations in your own backyard, you meet people that are outside of our sector, and sometimes with people with a lot of power and influence that can help keep us from speaking in that echo chamber. But one of the unfortunate number one places that Georgia holds is maternal mortality. And that's not where we want to be. It's one of the worst states. It's not the worst state for maternal mortality rates. And it's an ongoing public health crisis that affects all women and pregnant people. But the situation, as we know, is very dire in Black women and other women of color. Research has shown that Black, Native American, Hispanic moms all face a much higher rate of mortality than white mothers. Can you speak to some efforts to combat maternal mortality and protect moms domestically or internationally that you might be working on? And I'm going to, Dean Davis, I'm wondering if y'all are doing something.
Well, I think we look at the work of trying to get access to care, to look at child spacing, but it really comes down to what Dean Fallin mentioned, are the structural racism and the effect that that has on a woman's health, that we are trying to figure out all of those factors and be able to intervene on those factors where we can, with centering pregnancy work that some of our faculty are doing, with working with communities for access to care. Sometimes women in rural Georgia don't have access to a physician to help them with prenatal or postnatal care.
That's great. Dean Fallin, and there's a lot going on in the space at Emory.
Yeah, so and not just at Emory, I think one of the key things for us is there should be a lot going on in this space across the state of Georgia, right? And so one of the things that we've been working on is how do we help convene and facilitate partnerships across all the universities doing really important work, but as well as the Georgia Department of Public Health, many of the advocacy groups and other community-based organizations, and hospital systems that serve women. And, Marsha already mentioned, there are, I don't remember what the count is now, but let's just say over 50 counties in Georgia who don't have an obstetrician in the county, right? And so when you think about how you get access to care, that's a tough one. If you have any complications, getting access to specialists, particularly for cardiometabolic problems that are really one of the sources of high mortality, is just a really important thing to try to tackle. And so I think we need to be doing it all the ways that and we are, in the ways that Marsha just said. We need to think about what are the components of access and how can we affect change in those. We need to think about how we bring evidence-based practice to bear. So even if you have access, what's the quality of care? And then that quality of care then relates to what was mentioned in terms of structural racism. So CDC, for example, just started something called Listen to Her. I don't know if you guys have talked about this in some other context, but this is really about, in particular, listening to Black women describe what's happening with their bodies and having our care-facing providers trained in understanding that. It goes back to the cultural humility stuff that we're talking about in other contexts. That I think could do a lot of good. And so there's a lot of training potential that we could collaborate on together in addition to these other pieces. And then the last thing I would say, because I started with my interest in public mental health, one of the other leading causes of maternal mortality are behavioral health related, so substance use and suicide. And so also figuring out how we build a robust system of care for mental and behavioral health for pregnant and postpartum people. That the maternal mortality is not really just about when you're in the hospital giving birth. It's the things that lead up to it, but it's also the year after that you have these high risk moments. And so I'm enthusiastic that as a state, we're better collaborating to do this, but there's so much to be done. Sorry, I went long-winded, but I really feel passionate
No,
about this.
you're great. This is really important, and it's a critical issue. I know at a state government level. I know it's very important. But Dean Lynn, anything to add? I know Georgia State's doing a lot in this area too.
Yeah, I mean, not a lot to add. I will say that we sought out and received funding from HRSA, their Maternal and Child Health Catalyst program, to expand our curriculum offerings in maternal and child health, and we've developed a certificate with that support, and we, actively work to recruit our graduate students, as well as those from outside of the college and across the university and other areas as well, to make sure that we're leveraging those resources as best we can. So I think including and recruiting underrepresented racial and ethnic minorities into the program is important, but it really is everyone that needs awareness and support and training. So we're doing what we can there.
No, that's great. And I'll just do a shout out to a couple of organizations that are in the Georgia area that really exemplify collaboration. And I know at least Emory is involved with the Healthy Mothers, Healthy Babies Georgia Coalition. That's very active. And I believe they're seeking an executive director, by the way. So if anybody on the call that's looking for something, has some experience, they are looking for a new ED. And then there's also an amazing organization called the Center for Black Women's Wellness in South Atlanta, and they do a lot of great work and a lot of cross-sector collaboration. And I just want to stress in this particular area, putting on my bio and med tech hat, there's a lot in the private sector going on, and there's a lot of money in the private sector that can be capitalized on through partnerships and collaboration with academia and community organizations on the ground to help really dive into this issue. And to all the Dean's points on this, it's really about connecting and working together and finding pathways to work to get us from that number one spot to really improve health for women and for, during, and after they carry. And I know we're kind of a little all over the place. There's so much in public health. So I do want to talk about climate change before I run out of time, or whatever your government affairs departments want you to call it at this point. But everyone faces health risks from the health impacts of an evolving climate, which has been termed by the WHO as the greatest health threat of the 21st century. And the responsibility to protect the public from health threats of climate change fall largely on our, and this is a domestic thing again, but our state, local, territorial, and tribal health departments. But what are some examples you've seen that are working to accelerate capacity, preparedness, and resilience to address health effects of climate change? And that can be domestic examples or international examples. Who wants to go first? Who unmutes first? Let's see. Danny, why don't we go with Dean Fallin?
Sure. So indeed, as you've said, this is one of the greatest challenges to health and public health. And it's one of these things, much like I said with mental health, I would challenge you to find a place of public health that doesn't include and can be improved by better mental health. There is no place in public health that is not affected by climate change. And so it is critical that everything we do has the lens of climate in it. And so one exciting thing that I think may be helpful to all of us on this call is we have a recent NIH award for a Center for Climate and Health. And one of the first things they're doing is creating a dashboard for climate indicators for the Southeast region of the US. WHO has done this at a global scale. So we're using some of those same metrics, but building partnerships locally that would have access to those kinds of data. And Yang Liu, who runs this, who's our chair of environmental health, has been reaching out, I think, to several folks at Georgia and Georgia State, as well as other partners, to talk through what are the right metrics, what would be useful, and that to be then a public-facing dashboard that we can use for legislator discussions, but also for research and for things like that. So hopefully that's useful for all of us. That's coming around. The other thing I would say is in Emory Healthcare, we're actually working with the data folks there to bring weather and other climate-related external data into the healthcare data system so that we can do a better job of predicting weather patterns and other things that will, increase heat-related issues in the emergency department or create problems in terms of food security, those kinds of things that would affect the patient populations, but also have a public health indication that we would want to know about. So that's just a couple of examples. There's so many that we could be doing together.
That's great. Dean Lynn?
Yeah, I mean, I think great to hear Danny about the new center. That's really exciting, and I know that we'd all love to contribute in whatever way we can. So that's exciting for the school, but also for the city and the region. So wonderful. Yeah, I mean, I think climate change is one of those things that all governments sort of agree on the science around, but the sort of taking action part, and who's responsible, most responsible, and how to track emission reduction. It sort of it goes splinters at that point. So I think there's a lot of work to do here. It's great to see progress being made in investment in alternative energy. But I think things like I think it was Marsha that talked about, and Danny both talked about the importance of community. And part of the question is, how do we support communities in living the healthiest lives they can in the context in which we exist? I think the dashboard Danny mentioned is great. We've made progress on air quality and keeping individuals aware of danger there. You think about the fires we had, I don't know if it was last summer or with the Canadian fires. We've come out of the pandemic cycling for transport more than we had in the past. We need to hold on to those gains. Things like we need to reduce meat consumption. I mean, so there are things that we can do, the things that we're making progress on. At the end of the day, I think public health has to connect with people where they are, and do the things that help people live the best lives that they can in the face of a changing climate. Right.
Dean Davis, anything to add? I know there's a lot at UGA and food and ag on the innovation side, but how about in public health?
I'd like to echo what Dean Fallin and Dean Lynn have talked about. It's the communication. I mean, our dashboard for wastewater surveillance during COVID, I mean, that really raised the attention. Everybody kept waiting to see what the wastewater in Athens was going to be that week. So I think if we can get that sort of attention around the effects of climate change, we have an Institute of Disaster Management, but I would love to see that broadened into disaster preparedness, not only with what you do physically, but how do you prepare emotionally for that? How do we account for migratory patterns that happen as a result of? So there's a lot of work to be done, but I think awareness and communication are the first ones. I love the dashboard.
No, that's great. And, that Institute for Disaster Management does some amazing work and some really interesting partnerships with the private sector as well, because there's not that many institutes that specialize in disaster management. So, and yes, of course, preparedness would be critical. Well, we have about 10 minutes. So if anybody has any questions, please drop them in the chat. I've got a couple more for our deans here before we wrap up. But this one, I'm going to start with Dr. Lynn. But, what is, and for everybody, what is the most important challenge that women in public health face today? And for Dr. Lynn, we'd really appreciate you speaking to your role as a male champion for gender equity and equality.
Yeah, well, great question. I think I'll look to Marsha and Danny to define what the greatest challenges are. I'll just share my perspective that as a leader, we all have really important roles to play in ensuring that women and other groups that have been discriminated against or left out are included, are at the table, are represented in leadership and across the organization. So I think that's one of the things that really I try to focus on, constantly asking myself, what is the potential impact of this decision or action on women, on, a variety of groups. So I loved, Marsha's comment at the outset about the importance of some men in her life. And I think there are many men who would say the same thing, that there were women that, really stepped in and provided the kind of direction and support that they needed. So I think, we've got to go together, but we also have to realize that we're social beings, that historically there's been discrimination. There's been social and cultural norms that have served each group differently. And that discrimination lasts and has remnants for generations. And so it's up to us where we sit today to shape generations ahead. And that means ensuring that equity for gender, race, and those intersect is central in our thinking, our planning, and our decisions. And that when we look around the table, we ensure that it's not just the perspectives of one group, in this case men, but you also have representation and equity representation from women as well. So that's a little bit about how I think about it, and how I aspire to work day in and day out.
No, that's great. Thanks, Dean Lynn. Dean Fallin, anything to add?
I love all of Rodney's comments, so I won't burden us with repeating any of those wonderful things. The other thing I would say is, as well as there being challenges for women, and particularly women of leadership, there are lots of opportunities. There are lots of things that I feel like I do well because I was raised identifying as female, that are really helpful in what I do now, and the ways in which I can help to influence what happens for public health. And the other thing to say is, I take it very seriously, and I think many women do, the modeling that we provide. And so the responsibility to bring folks with us, and to make sure that the kind of inclusion that many of us are now privileged with continues and expands.
And I would just like to add to the role modeling, just mentoring of all people, of all genders, of all identities, just to be able to have people in your life who are older, younger, with children, without children, men, women, just to help them be in your lives and provide you feedback. One of my greatest mentors is not in public health or in academia, but when I talk with her, she gives me a perspective that I would not have had. So I think it's that connection. I know there was a question about being isolated in a post-COVID environment. And for us introverts, it is really hard. But to be able to make that call and to take advantage of, people really want to connect on any level, whether it's Zoom and webinars or over the phone or in person, and not to let that get in the way of seeking out those voices, to maybe add new voices to your head, or to get rid of any imposter syndrome that you might have.
Thank you. I was going to ask for y'all to comment on Alexis's question. So I think that's some great tips. I don't know if Dean Fallin and Dean Lynn have any other ways for people to tackle that isolation in a post-COVID environment, especially if they're looking for jobs. Practically speaking, I always tell people, especially those that are introverted, and despite what people think, I'm very much an introvert, and I hate going into big groups and having to meet people, but it is my job. And I would say, set a realistic expectation for yourself. I heard this during a talk about how to network years ago. Say you're going to go into this networking session and I'm going to meet one person to get one business card. And that's your only goal, and you leave. You don't have to stay there put yourself through a whole hour of that. And maybe the next one you get 2 business cards. And then the other tip is follow up on LinkedIn. You have this advantage that none of us on the call had 20 years ago. If you're hearing from great deans, and they may not be the one to respond to you, but connect with someone. Hey, at Emory, that hey, I heard Dean Fallin talk about this particular degree program. I'd love to learn more about your career path. Ask for those informational interviews and conversations. Worst case scenario, someone says no, and chances are it was just online. So it was not too much off your back. That's just some of those tips that I'd have as well.
I would add persistence. I think, one, persistence when if you want to meet someone or learn more about their journey. I think anytime you take an interest in someone else, they're probably more likely to respond, and so, in that they'll want to ask about you at some point. But I think sometimes what happens is we email someone or we reach out and there's no response, and we take that as an answer. And often it's just a busy moment, and I wasn't responding to anyone's email for 2 days, and so being willing to follow up and not take the non-response immediately as they're not interested in talking to me. Persistence, people are busy, try again. So I think just not giving up right away, can help.
Yeah. And just to get to Brittany's last question, who kind of builds on what we've discussed, as a student who's starting out, about to start their MPH journey at Emory this fall, what can I do now to be a competitive candidate when pursuing a career in public health?
Well, I can jump in first and say, yay, welcome. We're excited to have you. I think Maria already answered this earlier in what I think was a wonderful way, and that is, don't forget that all of your engagements, if you're passionate about something that you're working with a nonprofit in, whether it's homelessness or food insecurity or violence prevention, whatever those things are that really are what you feel personally about, that is public health. And so getting engaged in those things, and you'll start to see where those lanes open up, where the things that you're doing as part of your master's training fit into the goals that that organization is trying to accomplish. And that will set you up for, once you leave here or any program, to see how those things can come back together. Because once you have an MPH or whatever master's program folks get in public health, the sky's the limit. Like, you can work for Booz Allen and work on, their health related consulting gigs, or you can work in, state or local government, or you can work in a nonprofit or a university, or you can work in all kinds of other sectors that still need this kind of health related competency. And so I think following your passion and seeing how it relates to public health and doing that right away, because nothing's holding you back from engaging with these organizations today, is a great start. So what she said.
As Rachel comes back on, and we'll ask this last question, can I ask all of our speakers to smile for a second for a picture from social media? 3, 2, 1. Thank you. So make sure we get a decent picture. But there is one other question, so I'm going to ask for an extra minute of your time. So I think it's an important one from Eddie at the Metro Atlanta Chamber and a fellow MPH here. Thanks for the shout out on how public health ties into economic development. Can you give me one less than 30-second example of successful public-private partnerships that might be replicated? Dean Davis, you're off mute. Let's go with that.
Well, I think it's with examples that I had were with foundations, with industry, with really local agencies that have been great when you talk about workforce development. In obesity, for example, if you don't have healthy, this is how you can talk about works like wellness. If you don't have a workforce that can come to work, that is free of chronic disease and able to move about, that ties into workforce development and economic development.
Mm-hmm. Any final comments from Dean Fallin or Dean Lynn before Rachel closes out?
I'll just add, there are so many examples of that from us working with Gilead or other pharmaceutical industries to bring public health evidence to bear in the dissemination and access to drugs in that particular example, but in many others. And then Marsha's workforce development. There are so many ways in which we can provide fairly low cost technical assistance and training to companies that is really valuable and accessible again, for a little bit cheaper than you might be getting the other way.
Yeah,
So the sky's the
definitely.
limit in those. And thank you all
Yeah.
for the opportunity to have this conversation. I love
Yeah,
hearing
this has been
from
great.
Rodney and Marsha and their perspectives.
Definitely. Yeah, and Dean Lynn, just two things I meant to say. One, check out the CDC Foundation's climate health page. They've got a lot of opportunities, including some ways students can plug in and take action on climate and health change through their portal, social media, and other platforms. Just Dean Lynn, any final comments from you? Are you good?
Well, no, just thank you, Maria, for and Rachel for helping organize this and bringing the three of us together with the other attendees. This has been really wonderful. It's a pleasure for me to participate, and hope to do this again as well.
Yes, definitely. I'd encourage you also for public-private partnerships. For those in the public health world, you might not be as familiar with ARPA-H as the private sector is, but that is an excellent example of where government did move in a post-COVID world to help facilitate really innovation with the public health world and other community partners on the ground to accelerate change. So if you're not familiar with the ARPA-H agency, take a look at that. And there are community organizations, and their community hub is looking for partnerships with community organizations on the ground across the country right now. So with that, I'll hand it over to Rachel to close us out. Thank you all again.
Sure. Well, on behalf of Women in Global Health Georgia, thank you so much to Maria and our incredible panelists for this really fantastic discussion today. I'll just highlight in the chat, you can find more information about our Women in Global Health chapter, and our next upcoming networking social is coming up on May 16th. So I hope to see you there.
Thank you, everybody. Thank you to the deans and Rachel, and have a wonderful day.
All right. Bye-bye, everybody.
Thank you so much.
Bye.